Hello and welcome to a special video edition of Longevity Now, the place for all your news and views of life extension from around the world. Now, I've been advocating for rejuvenation research and raising funds for such things for over 20 years now. And one thing I've noticed, there's a lot of biohackers who are very interested in trying to prolong their life or get healthier. And they take a lot of different supplements and therapeutics and they try different lifestyle hacks. But many times don't keep good track of objective measurements of whether or not that particular intervention helped. A lot of people say, well, it made me feel a little better. I didn't feel that much better. I had more energy. I had less energy. I had brain fog or something like that. And not much in the way of objective measurement. Now, some people do a real good job. They take their biomarker data, they put it into spreadsheets, and they can create graphs and see if things are working or not. But what would be great is if everyone could have a standard platform that made it very easy to look at biomarker data and keep track of objective measurements and share that data with each other. Maybe even do some combined experiments. Well, in an effort to help out with that, Longevity a couple of years ago started a aging biomarkers program. It was eventually renamed BASE, which stands for Biomarkers of Aging Self-Experimentation. And we offered some money to get people tested if they would report their objective measurements when they did an intervention so that everyone could see, is it working? Is it really something worth pursuing? Well, as an add-on to that, Longevity eventually gave a grant to OpenCures to develop a platform for everyone to collaborate and keep track, again, of those objective measurements. And today in Longevity Now, we're going to talk with the founders of OpenCures, Vincenzo Domina and Kevin Parrott. And you might recall Kevin Parrott's name sounds kind of familiar, one of the original directors of the Longevity Forum or Immortality Institute way back in the past. So let's have a listen and see what we have developed. All right, now let's bring to the broadcast here the two founders of OpenCures, Kevin Parrott and Vincenzo Domina. Yes,
hey,
and
good,
well,
good to see you. Having us.
Wonderful to have you guys here. The first thing is, I'm sure people want to know is just kind of give us the overview, Kevin, of how you founded OpenCures quickly, kind of the Cliff Notes version, and
Sure.
what you hope for the platform.
So I've been, in aging research for almost 20 years. I started this because I didn't want to fall apart and die on schedule, and I would prefer if my parents didn't either. And so for me, it was all about getting interventions. I got involved in the community. I looked for people who were doing things. I found Aubrey de Grey. We worked at the Methuselah Foundation together. We co-founded SENS Research Foundation together. And actually what started it all off was I was the one of the original directors of the Immortality Institute, which was pre-Longevity, and is actually still in existence. It's amazing how productive and the people that have come out of that period at the Immortality Institute, because many of them still contributing to the field at large. They have companies, they're doing research. These are people who got involved because they saw a problem that needed to be solved, and they didn't really need a financial incentive right at the beginning. Life and health seemed to be enough for them and for most of us, and it seems to be enough to keep us going as well, because we've all been doing this for 15, sometimes 20 years, some of us. So that started off the whole ball rolling, was just the not wanting to die of an age-related disease. But then when I found out that things are incredibly slow, and I realized I became a cancer survivor, and I thought, well, things aren't moving fast enough, From a cancer survivor's perspective, you look at all the promise out there, and it's just not being translated into real world boots on the ground kind of interventions, and it's not fast enough. Now we have this explosion of interest. We have a lot of financial interest coming in. I hope that people with the money also want the interventions. That at the end of the day, that's really the most important thing. And one of the things we found out was that the consumer is not really involved in the whole process of research and development. So the people who need these therapies or who want the therapies the most have no control over their development. And so I created OpenCures to empower those individuals and harness their self-interest. These people who want the interventions the most, we can give them control over their data. We can ask them to focus the value of their data on the research problems that they're interested in. Therefore, we reconnect the development of the interventions with the people who actually want the interventions. And that's really I think the answer to minimizing time to the development of interventions.
Yeah, and I think that has been something sorely lacking in the biohacker community that has been very active over the last couple of decades, is that there just hasn't been a good way to get all the data together and analyze it, and share it, and thus OpenCures. Yeah,
exactly. So we're doing what probably the NIH and public health system should have been doing a long time ago. There's a lack of standards. There's a whole bunch of issues involved with aggregating data and sharing data and permissions, et cetera. But if you are a biohacker and you are in control of your data and you are informed, there should be no reason why a whole bunch of biohackers can't come together and create an army of data producers. We can create a human vivarium, basically, and hire ourselves out almost, if we felt like it, to help accelerate the development of the interventions we care about.
Well, let's bring in Vincenzo here to kind of talk about the OpenCures platform. I've used it a little bit. I've uploaded a little bit of data. I don't have a ton of data to use, but Vincenzo, he has uploaded a lot of biomarker data, and he's the main developer here. So Vincenzo, you can take the floor, and maybe we can get a little introduction to the website, to the platform.
Yeah, sure. Thanks for having me, Justin. I'm pretty excited. I'm a first customer in that case. I have tinkered around with the health software for a few years, but when I met Kevin, like this concept of metabolomics and bringing all data together, and like the new cures and the insights which are lying there in the data, this is kind of what drives me to create this platform, and I'm excited to show you. So I'll directly show my screen, if that's okay for you.
Yeah, let's take a look. All right, here we go.
Let's directly have a look. This is the OpenCures platform. And what you can see here directly, this is my dashboard. So when you come into the platform, I skipped the onboarding screen. We have that as well.
So the onboarding screen is where people would enter their data, their basic age, weight, different things like that.
Yeah, it would show you like in details and
biological profile, basically.
Biological
profile that everybody has to put in 50 times. Anytime you sit down and talk to a doctor, they have you a clipboard.
Enter your data, and then it looks like a very nice user-friendly dashboard here for people to quickly view a lot of different things.
Yeah, that's the goal. It shouldn't look like what your doctor is showing you when you're at the doctor's office. It should look like usable, user-friendly, and easy to understand, easy to overview.
So go through the dashboard a little bit here.
Yeah, so what you can see here is these are like cards which show you the averages from the last year, the last month. You can make a bunch of settings here. You can also choose other biomarkers for your own individualized dashboard.
So it's customizable, the dashboard.
Yes.
What you want to see on your dashboard, you can put there.
It has to be personalized. This is a personalized platform so people can get the information they want out of it.
Exactly. And what you also can put in here in your dashboard is when you create your own charts or when you participate in trials, and they have the charts which are automatically applied to your profile and to your data, that you can put them also in here so that anytime you log into the OpenCures new profile, you can see what you want to see.
Okay, so I see on the left-hand side of the screen, there's a charts section, but you can also put those charts on your dashboard to see maybe it's your favorite biomarker tracking that you've had over the last few months or years. You can have that right away on your dashboard, but there's also a chart section where you can create many different charts. That's correct?
Yes, that is correct. And it is a bunch of charts. So
for yourself, anyway, you've had a lot of data. You put a lot into it already.
Yeah. So basically what I'm tracking for myself, other than the blood scans, is the sleep and activity with the Oura Ring, the blood glucose with a CGM here from Freestyle Libre. and
And
my meals.
we're working on bringing in the Whoop data as well, and also BioStrap and a whole bunch of wearable devices, because that, I think, is the lowest bar for people to actually collect data, and eventually could be the best way of developing interventions, telling whether or not your health is actually really good.
Yeah, that's right. And it's easy. Those wearables collect data passively, and uploading it and seeing it in chart form, obviously very powerful.
Yeah, and I'm sorry, I think I get excited because the whole system is built around Vincenzo's. When I first started working with Vincenzo, he started talking about charts, and I'm going, we need data, and I'm thinking tables of data and numbers and things like that. But his brain immediately went to, what is the visual description of the data that people want to see? And so the whole platform is built around these concepts. And yeah, so I was saying, so how come we see the data? So he's one of the most productive programmers I've ever worked with. Anytime I want a feature, if it's necessary, he manages to pull it out of a hat, which is really wonderful. So we can now get the data both in chart form and in table form, and you can export it, and it becomes a JSON object that you can actually back up and share with other people. It becomes an object that is, it's portable. It's a portable object, and you can move it around the platform. You can include it in the dashboard. You can include it in your experiments. It's really the central keystone of the entire platform was these charts.
Yeah, that's right. And I see Vincenzo is kind of showing how you can put different labels on, show the table, show tags and different things. So there is a lot of functionality here.
Oh my God, it's tremendous.
Mm-hmm.
It's mind-boggling how much functionality. Considering when we first started talking with Longevity, we were looking at a simple, biological biomarker tracking app for a few people at Longevity, but of course, it turns into something that's much more multi-purpose and general purpose. We're very thrilled with the results so far.
Continue on, Vincenzo.
Sure, thank you. What we didn't mention so far, I'm also tracking my meals with the Chronometer app, and so we don't want only the wearables to connect them and the data, but also all these health apps out there. There are so many. Think about fertility tracking or these kind of things. What I'm using the platform for right now, I'm young, I'm still a healthy person, thanks God. But
not fertility tracking?
not right now. Comparing my sleep against my nutrition, I want to have the best sleep because obviously that's a big part for your health. And I want to see if I have deficiencies in my micronutrition. So here, for example, I'm tracking vitamin B, niacin, and I want to see how much is in my nutrition intake, so I kind of can have an idea how much I have to supplement with for my goals.
Great, and it looks like many different types of charts are available, or some functionality like you've got graphs. You probably have. I think I've seen bar graphs, scatter plots too, right?
Yeah, what you can see here is a scatter plot, but obviously there is no much correlation right now. But I'm looking for choline if that does affect my sleep. I had that in a previous data set. It kind of showed something, but it wasn't that much data, so I'm still looking at that.
And now one of the graphs, it looks like there might be a linear regression line on there. Is that a feature of the graphing, the charts section as well?
Exactly. So if you create a scatter plot, it will show you automatically the regression trend line, which is a linear regression for now. And down the road, a lot of automatic interpretation of the data we want to have, but that's the status for now.
Okay, yeah.
I'll just interject here in that so the data that we store can be visualized in any way. So we're creating an API sort of plug-in system so that others who do have other statistical packages that are capable of more, robust visualizations. This is going to be sort of like the free bargain basement. Everybody gets this capacity, which is going to fit most people's, 90% of people's interests. But there will be a way for, other entities, companies, maybe for actually plugging in visualization tools to automatically embed their own ways of visualizing the data.
Yeah, and one thing I've noticed myself throughout the year as I start to gather more data, I don't want to be typing it all into a spreadsheet and then making little graphs in the spreadsheet, which is kind of tedious, and then it's not, portable and things like that. So this
the friction. That's the friction, the inability, just getting the data, which is usually produced by a machine spitting out a number, that data, as soon as that machine spits out a number, it should be able to go into your profile immediately. There should be no data entry, almost no middleman, frankly. You have a data wallet. It is just like your own cash wallet. And when you produce data, or any company produces data using your biological samples, those numbers should go directly into your wallet, and you should have control over the value of that data.
Yeah, that's another great thing about OpenCures, I think, is that when I've gotten other tests from companies, they just kind of keep your data and they give you one number back, but they have a ton of data about you and you don't have access to it. In this instance, we have access. It's like putting people in control and in power with their data. Well, 100%. Vincenzo, go through a couple of other things you want to highlight here on the platform.
Yeah, thank you. Extending the point of Kevin, the main goal of this platform is to be open in, open out. And that means, for example, we are working with all the APIs from the other apps that the data can get in automatically if you authorize these apps. So that's one way to bring data in. But we focus so far on bringing data in through a spreadsheet. Because what we noticed talking to the people, many of these people, they have spreadsheets already, or their favorite health app just give them a spreadsheet. So this is what you can import here. We created some automatic routines where you can directly use the format you got from the health app, for example, from Chronometer, from the Freestyle Libre, the glucose CGM. And you just drag in the CSV file in here and click on import, and it's automatically imported. But also, apart from that, maybe that's even more interesting for you. Lab test, right? So that's even more health information. I'll just show you that quickly, how that looks like. I have a comprehensive mail panel here from Life Extension. And if I drag that in, it just scrapes all the values from this PDF file, and it
fills it in.
Double check, and if you give it a timestamp when the blood draw in this case was taken, you can directly import that data and use it for charting.
Wow, that is very nice, because I know many different types of tests you get from many different types of companies. It comes in PDF form. And being able to automatically upload that data is wonderful.
And one of the sad stories is that they don't have to give it to you in PDF form, but they don't want to give it to people in a spreadsheet format because that makes it much easier to work with, and they don't want you to work with your data. There we go.
It's important, Kevin.
Pardon me.
No problem. So you're looking at your data here, where you uploaded a bunch of different things in the
right.
site.
So what you see here is the list of you can manage all your data imports, and what I'm tracking for myself, for example, is also interventions. When I went to the sauna, when I have migraine symptoms, I log my symptoms to compare that in the graphs against the other data to find insights for myself. I track tags. So on the
I think that's an important point to feature here again, is that you can put in unstructured data too. Like one day, say you were feeling depressed, or one day you had a headache or something like that. And you can put those little markers, those little tags in there so that you can see and compare it with your other biomarker data and see if things are affecting, if there's some correlation.
Yeah, and I think the HTML5, the version we have that runs on phones, which is a non sort of native app right now, is capable of, we could do better in terms of once it's a native app. But right now it works fine for the more disciplined person who wants to put in that kind of information.
Sure.
For sure.
Yes, how I use it, if you have an iOS phone, or I think even with Android you can do that. It is responsive, so you can use it on your mobile phone as well. And what I used is plus sign here for you on the go. You just open the app and you can simply type in a tag, and that is then saved with a timestamp, for example.
Wow, that is easy. Especially people are on their phones all the time, and they might be feeling upset stomach or something, and all you have to do is open your phone, boom, put in, say, I had an upset stomach on this. You just have to say that's your symptom, that's your tag, and it automatically gives it a timestamp.
And this is another feature that, like the charts, Vincenzo was sort of championing from the beginning. And I was kind of going like, we need to work on other things. But he made sure that this was a major feature that was available to people, because it is really now, you can tell how important it is when people actually are using it.
Yeah, and for that, there is no API, right? So some things you have to log to really find the insights like that. And so what we did is also to open that possibility up. If you want to log a lot of things yourself on the go, that's actually possible. So here you can see this is everything what I track on the go, or one time a day I go through the list and just click on that and say add, and it's added. But I could also add a lot of details. So this is obviously the full form. So this is.
And if you notice, most of these are custom biomarkers on the left. You can see, so these, you don't have to just track things or name things that are available in a lab report.
Right.
You can actually set up your own biomarker, basically, or activity, and you can log that as a sepeate item. So,
like
and a lot of things
Vincenzo right now is showing stress level, and you can set up your own little tracking of the stress level and put in what you felt during the day, and then you can track that. It's not a lab report or anything like that, but it's self-reporting.
Yeah.
Right.
Yeah. So we use standards. We use standards like LOINC codes and various other things that are industry strength, but we give people the flexibility to step outside of those restrictions.
Sure.
Because most people, frankly, that's what people are. Stepping outside of most of it is personalized. Yeah.
Mm-hmm. Yeah. So we really wanted to open up that you can import everything and you can track everything. So that as a technological basic. But really the power is when we talk about experiments or trials. So if you and your biohacker friends, or you are in a disease community, or you want to participate in these trials where they repurpose drugs for longevity, this is here our platform should make that possible for managing that and for having a market, let's say a marketplace for that, where you can browse, search, and create your own experiments together with your group, with your community, and gather that data together.
So again, this looks like a feature of the platform that can bring people together to collaborate and actually get real data, biomarker tests through an experiment where they might use, like you said, an off-label drug for longevity or something like that. And eventually share share the results and let people know, what's working, what's not working.
And importantly, when you go through the definition of the experiment, basically we create a knowledge container which contains all of the scientific, sort of rigorous scientific information that a lot of non-scientists really don't think about. And so anybody can construct an experiment and then share that experiment template.
That way, then other people who want to join in have a template to follow so that it's standardized, basically.
Yes, so the results are comparable. At the end of the day, we need good data. It has to be rigorously scientific as possible. People have to be doing the same things in the same way as much as possible. Yeah. This just helps sort of herd the cats of human. We create a virtual human vivarium of the willing who are interested and disciplined enough to follow the same instructions. And at the end of the day, what they have is a data set that is comparable to anything that a biotech company could produce with a clinical trial, and that they can then direct the value of that data themselves, because they own their data, they own the value coming out of those data sets, and then we will get faster intervention development.
And Vincenzo, I see here on the screen that you're sharing that it looks like not only could biohackers collaborate together for an experiment, but you might be planning to use this particular part of the platform for other clinical type trials. People could use this perhaps for any clinical researchers out there, maybe?
Exactly. So now I'm really getting excited. So I'll show you that, how that looks like.
Okay.
So what you can do, you can create your own landing page with the video graphics.
So who is this? Who is this experiment for?
This experiment is managed by HSRX, and they are examining rapamycin for longevity, for increasing the health span of humans. So it's they collect human data, and it's
an actual bona fide trial, IRB approved trial.
Yeah, and it's not just a landing page. It's mainly the protocol and other management tools where you can set up a protocol with a lot of details and descriptions and links and whatever, everything you need, and show that what you as a participant should follow, and you'll get notifications and other emails and whatever is set up there.
I think that's pretty important too, that you just mentioned that, getting notifications. So if you get in a trial like this, you can get your notifications for when you're supposed to be taking the particular therapeutic and what you're supposed to be monitoring and things like that, correct?
Exactly. So really the participant engagement there to ensure that the protocol is followed and to help the trial manager. Exactly. So I can show you another example as well, which is more sophisticated. For example, the glutathione program. Here you can see a protocol which is more. Here you can see a protocol which has more features. For example, if it's just an information, it's just there. You don't need a notification for that, but it tells you what to track. This is if you have to do a lab test or something, or if you receive something, a kit, so to manage all these steps and when to take an intervention, the details, how much and when, and the schedule.
It's just the beginning. Each of these steps, of course, has a lot of detail associated with them, but this outlines the step by step so that people can at least follow the same instructions. Without having to guess. And then this is also shareable.
Exactly. And you can look at it on a timeline, on a Gantt chart, and you can manage materials if that's important, like the kits or the interventions, if that has to come from one single source to manage the quality of the data. And with that, your data really gets like meaning. And the power of this really is, and what I'm mostly excited is all these trials. And for example, HSRX, they are doing a lot of mini trials, which are, or from a budget perspective, they can't be FDA approved because obviously there's a lot of effort and documentation. But here they can easily manage the trial here. And if you participate as a biohacker, as an interested person, or you have that specific disease, what is tested here, you can get the data for free because you participate, and reuse that data for your own purpose here, because this is all like the same language, and you can even reuse that data in other trials, or you can set up your own trial and
so you can share your sorry to interrupt, but you can share your data not just with one entity, but you can share your data. So normally data is locked up in the clinical trial. Nobody gets to see it except the people who run the clinical trial. And if it a lot of negative data rarely gets published, it sees the light of day. Whereas this is, you are in charge of your data. If you want to share it with 1 million people, 1 million companies, you can. You are not, if you want to engage in an agreement with others where you limit other people to, who gets your data, but the point is you're in charge of what happens to it.
And this has been one of the key aspects of Longevity and the Immortality Institute, now OpenCures as well, that you own your own data. You're able to share the data if you want. You get to see all of your own data. So that's a real key point. Thanks for bringing that up again, Kevin.
Wow, it just makes sense. I don't know why the system doesn't work like this to begin with. But anyway.
And one exciting point I have to add here, one pain point is if you participate in trials, right? You have to enter data in over and over again. And with having here something like a health identity, what we collect here is that you create your profile with your demographic information, and that's it. You enter it one time, right? And not a several time. We collect disease information, your goals, like phenotypic data, and you enter it one time. And then if you want to, or if it's needed for the trial, you just click on join and it is shared. And when you
so you don't have no more clipboards, no more
Right.
pens, no more faxes. People
No
should
more
be able
paper.
to just have their profile, and if anybody wants to, if they go see a doctor, the doctor should just already get permission from them to access their personal profile, which they are in total control of, not having this information in a million places out there. Anyway, this is the beginning of the inevitable consolidation of a person's digital identity, starting with their health data, which is potentially, arguably, the most important data that they can control. But our data belongs to us, and this is we have to create a wallet a system where we are actually in control of.
In control, yeah, secure wallet of our data that we can control, right?
Yeah.
And I know what your next question is, so I'll answer that before you ask. Privacy, right? And control of who gets to see what and where. So we even plan a lot of more settings and more granular settings here. But what happens? So this is your settings panel. What happens when you join an experiment? I can show you that, how that looks like. Let's choose a more sophisticated one. So this experiment I haven't joined yet. So I click on join. And what we do, we collect your consent. So that is also saved as a timestamp. You can review that. We quickly line out what will happen and explain that from our side. But as an experiment creator, let's choose another experiment. I think that one had more. Here I'm active. As an experiment creator, you can create your own questionnaire and your own consent paragraphs and show that to the user. And that is also, I'm active, I'm participating.
You've joined them all. You've joined them all by now, I'm sure. There's nothing that you haven't joined.
But the point is, it's customizable. When you create your own experiment, you can set up
There it is.
consent, privacy, things like that. Okay.
Yeah.
Exactly. And you can, this is a full-fledged form, so you can enter different kinds of questionnaire, and can make that also required. So you're not able to join if you don't answer all or
It's the minimum. It's the minimum bar that you need to have. And I think what is different than other trials, I think what we will integrate into the future is sort of like not after tests, like quizzes or things like that, to show whether or not a person has actual understanding of the information that they are reading. Because if they come up with an insight or a criticism or whatever, but they don't understand anything, we have to find some way of measuring the understanding of individuals of these things. They can answer questionnaires and agree that they understand, but what is the real world objective measure of their understanding, I think, is something we have to attend to.
Okay, yeah, so we went through the charts and we went through the experiments here to give everyone a flavor of what is possible here. In the time we have left, Vincenzo, is there another aspect of the platform that you wanted to highlight?
So many aspects.
Give us one more. I see you have how-to and resources on the menu there as well.
Yeah.
So there's tutorials to kind of help
Yeah, so
out.
this is going to be part of the educational aspects as well. Yeah.
Obviously, it's a lot of work, and a pain point for every user is that it's also complicated. This is more for people that want to dive in and want to have advanced analytics features for themselves. For that, we have created a lot of videos, and we want to expand that even more. So to make that really easy to follow, easy to learn how to use the platform for interested
Great.
individuals.
Yeah. So people are watching today, they can see kind of the basics, but you can go through these videos here, at least some introductory videos that it can really help you get started then.
Exactly.
And I see once again, you have the how to import PDF reports there as a video, which is great because I know that OpenCures has been collaborating, I think, with Prodrome Sciences as well, right, Kevin? And
that's right. So
and there's a real in-depth test you can get and import into OpenCures. Could you tell us a little bit about the metabolomic or proteomic scans?
Yeah. So originally, OpenCures was I was going to buy a couple of mass spectrometers and help people measure their biology using mass spec. However, they're like over $1 million each, and you need to pay people $1 million to actually run them. So it turns into a rather high startup cost. And so that's when we decided to just outsource to contract research organizations. And Prodrome Sciences is one of the leading metabolomics providers in the whole Bay Area, in fact, probably in the United States. And it's the only company that has a assay which gives you an overall view of a number of metabolites. It's called the Prodrome Scan Blood Test. It's up on the screen there. You can order it through a doctor. If you have a doctor that's willing to, help you gain access, Prodrome is very careful about, how the data is presented to the consumer. They want to make sure that there is some support there. So they only allow you to order the Prodrome scan through a doctor, but OpenCures provides it to self-directed researchers who are capable of fully informed consent. It measures over like 300 different biomarkers. Many of them are lipids. Some of them are critical for avoiding dementia. Independently, when I was the chief of staff at BioAge, we found a number of biomarkers that were associated with extreme longevity. And yes, and here's my PDF, male 57. You can see that my total phosphatidylethanolamines are in the toilet at 17%. My plasmalogens, I've been supplementing, thankfully, and are at 61%. But just a month prior to this, my plasmalogen levels were at 19%. And plasmalogens are a new biomarker, a new sort of super omega-3 molecule that was discovered. If you have high levels, you are protected from dementia, and you are probably going to be one of those people who get extreme longevity. And now there is a supplement that Prodrome actually creates, which makes it through your digestion, because when you eat plasmalogens in your diet, they are destroyed in the stomach. So you have to live with whatever your body eats.
I'm glad I brought this up because obviously you get a ton of biomarkers with this scan, but there's also a supplement, a plasmalogen supplement that you could actually do an experiment and with a group of people and see how your biomarkers change with, wow.
Because it's never before, it's just recently that this supplement has been available. So although they've known plasmalogens are incredibly important for health, there's been no way of manipulating the levels in vivo. So with this supplement, we can now actually do not just correlation, but we can actually start looking at causation. So there is an experiment set up for the plasmalogen for longevity.
I see there on the screen, yeah.
Yeah, and they've been doing they just reported different results. But this is just one example of how data from untargeted metabolomics from people gathered over 20 years, they showed that these plasmalogen levels went high. These people lived the longest and kept their marbles. So this just fell out of the data. It was completely obvious, but no one had been able to gather enough data together to see this pattern. There was a low-hanging fruit thing, which then Prodrome Sciences hit the ground running with. But there is an awful lot of possible low-hanging fruit in the data. And this is just the beginning of looking at natural biological molecules, which are incredibly powerful. There isn't a single drug on the market that isn't trying to mimic the behavior of a natural biological molecule. Generally, there's a lot of drugs out there, but most of them are trying to just, pinch hit for a biological molecule. So let's just use biology. Let's find out, but because supplements are cheap and not necessarily patentable, the whole development aspects have been for these proprietary molecules which have side effects. but the power of natural molecules, I mean, well, that's what your body runs on, for Pete's sake.
Right.
Let's just focus on figuring out what it is that we can do for ourselves as quickly as possible without relying on $15 billion investments and 15-year turnaround times, because my parents don't have the time. I don't have the time.
Mine neither. That's right. One more thing I wanted to mention that hits again on the point we've been really talking about today about owning your data and being able to control your data and get insights from your data, the whole kind of open source aspect of it. And OpenCures obviously has developed a platform here, but I caught wind of the fact that you might be trying to develop a back-end data structure that's also very applicable to for any other types of platforms that might be in development in the future?
Yeah, go ahead, Vincenzo.
Exactly. I'm very excited about that as well. Of course, developing this platform and talking to a lot of other health data businesses or health data application developers, we kind of are recreating the same thing. So what we started to do is we created an open source project and are managing that through a decentralized autonomous organization with a bunch of other developers, other health data applications. And what we want to do here is really the back end and the common language.
Kind of get a standard way of handling data, health data.
It's like creating the first calculator that does plus, minus, divide, and multiply. It is so bizarre that we do not have standards for sharing data, because if you can't aggregate data or share data, you can't find insights. So we are at this level. It's so sad that we, as a separate organization, have to think about this. This should already be done.
And what we see on the screen here is kind of a flow chart of how this is going to be developed. Right.
Exactly. So in a nutshell, you should be able to. So this should be a software module which any developer can then use to quickly create a health application, or even for researchers with a no-code platform, to easily and quickly spin up a platform where they can analyze their data and find their insights to get quicker insights. And this is not only a data standard like FHIR or like loin codes. This is built on top of that, but we are creating the standard functionalities as a software, which is then open source and everybody can use.
Well, everything is looking great here from the user endpoint and from the back end as well. And the people watching today, they want to know, how can I start entering my data? How can I get into some of the experiments?
More importantly, if you can program and you want to see this platform live, join the open source collaborative and put your shoulder to the wheel, because we need to create this together. That's why it's a collaboration. So we can certainly piecemeal give people the capacity to, follow their own data and do all of that stuff for themselves individually and gain value from that process. But if we make sure that we do it in a similar way, lockstep together, we can basically change how research is done for humans.
Right. And
that, for me, is the more fundamental thing we need to create. If we could use our own data, and my ultimate goal is to create an in silico version of human health so that we can use it as a prediction engine for the testing of different therapies, different substances on human health. If we had a computer model of human health, then we don't need live humans at all. You can test millions of hypotheses on a virtual human biological system, which this data, your data will be in the DNA of this engine. So if you want your data to live on and become part of this in silico prediction tool that we're developing and benefit all of humanity, join us. And
Yeah, so
get
for
started.
developers out there, they should contact either Kevin or Vincenzo at OpenCures. For all the biohackers out there that might want to start entering data, the longevity people who are viewing this, you can contact me or Kevin or Vincenzo to get started entering your data and really start to collaborate more. Anything else they should know if they want to get on the platform?
Yeah, for sure. We are open to anybody.
Okay.
We have a Discord community which is very vibrant. You can everyone. It's totally open. You can come in and just look around. Not just calling all the developers out there, but any interested kind of persons with a life science or biomedical background or business
Anybody.
background.
Yeah.
We need
An army.
Well, thanks,
Right.
Kevin and Vincenzo. Hopefully we can get a lot of more people collaborating now in the near future.
If they want to live longer, healthier. Yep. Let's do it.
All right, thanks, you guys.
Ciao.
Thanks, Justin. Bye.
Well, there was a lot of information in this Longevity Now episode, so let's recap so we got it all. The OpenCures platform is a free platform for Longevity members. Of course, you can upload all of your biomarker data there, and some of it can be automated, like PDF files and CSV files. And of course, you have powerful graphical and analysis tools. You can share your data, or you can keep it private if you want. You can create your own experiments or participate in other experimental protocols to test out the latest therapies or life hacks. And of course, they're also working on an open source back end that could be the standard for health data management and sharing across the world. So there's not much to not like about OpenCures. And of course, they're also calling for developers to help out with that creation of the back-end data handling and sharing capabilities. So check it out. Maybe you have the talent to help out or start using the platform. Enter your data and see if all of those things that you're doing are really promoting your health and longevity. Until next time, I'm Justin Lowe.